Dr. Gilchrist is a clinician teacher at the University of Alberta. She specializes in genetic disorders of adult onset, including hemochromatosis. She is also a professor in the Department of Medicine with cross appointments to the Department of Medical Genetics and Pediatrics. Dr. Gilchrist says there is an increased interest in the study of genetics and disease.
Well, I think we're starting to understand more and more about the genetic contribution to disease. And so, yeah, there's a lot of different disorders that, I mean, you probably know about cystic fibrosis and muscular dystrophy for children. For adults, it's
And that's genetic?
Yeah.
Oh.
And for adults, it would be some the hereditary forms of cancer. About 5 to 10% of breast cancer, for example, is very strongly genetically inherited. Now, we're going to talk about hemochromatosis, which is an iron overload problem.
Which is something I don't think many of us have ever heard much about, and yes.
Yeah. Anyway, it's an interesting condition because it's actually fairly common in the target group, and the target group is Northern Europeans. This is a very white person's disease. And the thing about hemochromatosis is that even though you may have a genetic predisposition to store too much iron, and too much iron is bad for your body, it's very susceptible to environmental influences. For example, let's say that you had the genetic form of hemochromatosis and you were capable of storing too much iron, but you were a vegetarian, you were extremely healthy, you had 10 babies and heavy periods, you may never, ever collect enough iron to get into trouble.
Mm-hmm.
However, if you were, a big beefy guy who, drank 3 quarts on the weekend and ate a 16-ounce steak for dinner every night and...
which most of us does.
Yeah. Anyway, that person with the same genetic predisposition, might very well get into trouble with hemochromatosis because they're not only taking in more iron, they're not losing it.
You heard me say that Rain has hemochromatosis, that she inherited it from her parents. This is too much iron stored in her blood. And the thing that I guess troubles me about this, Dr. Gilchrist, is that most of us, women, if we're women, we're listening, or we're husbands of wives listening, most of us worry about that we don't get enough iron in our diet.
Yeah. And, that's when doctors are often... seeing a lady who's middle-aged and has kids and is burning the candles at all ends and is feeling tired. So they test them for anemia. And much to their surprise, the patient comes back as having too much iron rather than not enough iron. And that may be the route to exploring hemochromatosis for that individual. The good news there is that it's actually very easy and quite cheap for a family doctor to order a blood test to determine how much iron you have in your system.
Dr. Gilchrist and other experts in her field say that most of us should ask our doctor for this blood test as part of our routine medical examination.
I think it should be part of what I call the preventative medicine panel for middle-aged people. And when I talk about target population, we're talking Northern European white people, not Asians, not Africans, probably not Latinos.
Yeah, how come?
Not all genetic disorders are equally distributed around the world. So hemochromatosis is a white person's disease.
Isn't that something?
Yeah. So anyway, you know how when you get middle-aged, everybody wants you to check your blood pressure. They want you to check your fasting blood sugar. They want you to check your cholesterol. Well, I think it's simple enough to do percent iron saturation and ferritin, and then you've got another check for a relatively common disorder in that population, Northern European.
Do regular MDs know about hemochromatosis?
Well, I've been talking about this for a while, and it's certainly been a lot in the literature for the past 15 years. but it's probably not as well known as, say, high cholesterol causing heart disease.
What if she hadn't been diagnosed when she was?
Well, the trouble with absorbing too much iron is that the body will tuck it away in the liver and in the heart and in joints and skin and in a lot of different places. And it will start to actually poison the tissues that it's stored in. And the biggest problem with hemochromatosis is it can lead to cirrhosis of the liver. And
so you seem like an alcoholic when you die.
Well, alcoholism is one of many causes of cirrhosis, and it's the one that's most commonly thought of. This is where I talk about the effects of the environment on superimposed on a genetic predisposition. If you have the genetic predisposition to store too much iron, that is genetic hemochromatosis, and you are also an overuser of alcohol, or you have some other insult to your liver like hepatitis B or C, then it's like being attacked by two people instead of one. You know, there's more likely to be damage and damage earlier.
Hemochromatosis has been called the bronze killer by an author whose husband and daughter had the disease. And that's because many of the people with hemochromatosis, their skin turns kind of a muddy brown color. I've also heard it called the silent killer, because unless you know exactly what you're looking for, you may not notice or even have any of the symptoms. Dr. Dawna Gilchrist.
You don't have to have symptoms. You don't have to wait to have a heart attack before you have a cholesterol test done. You don't have to wait until your kidneys are dying from diabetes to find out your sugars are too high. And you don't have to wait until you have symptoms of hemochromatosis before you can have your iron levels tested.
Is it mostly men or mostly women?
Well, women have I hate to call it an advantage, but menstruating, so they're always losing iron.
Oh, so, that's the blessing of
yes, and the thing of having babies, that uses up a lot of iron too. So men are generally heavier meat eaters than women, not necessarily, but in general, men with genetic hemochromatosis will come to symptoms earlier than women because women have a natural way of losing iron. In fact, I have a few patients that despite the fact they have genetic hemochromatosis, they have such terrible periods and bleeding that they're actually anemic and have to take iron supplements.
Why Alberta?
Why Alberta?
Mm-hmm.
Lots of Northern European people.
Why not Asians?
They just don't have this genetic predisposition. And what it probably means is that the abnormality started up, after, the Asians went east and the Northern European went north.
When we talked about multiple sclerosis on the Inside Story, we talked about vitamin D, and we talked about there's not a lot of that in Alberta. So that was one of the things, not doctors weren't pointing their fingers to, but that was, so is there something about our environment or?
No.
No.
No, it's a chance event, but it happened probably about 20,000 years ago in Northern Europe. So that's the population that has it.
This is Michelle Boden. We're talking about hemochromatosis today on the Inside Story. You're not going to believe what you're going to hear. Back to that bloodletting and phlebotomy and more people with hemochromatosis as we continue on the Inside Story right here on 630 CHED. We are talking about a little-known disease with a great, big, complicated name, hemochromatosis. It's described as too much iron stored in the blood that if left untreated will start to attack your organs. People with undiagnosed hemochromatosis can develop severe diabetes, liver disease,